Hi. Good morning, everyone. Thank you so much for coming out this morning to join us as we talk about quality wash services. And as I look for my clicker, thank you. My name is Adam Questad. I'm a senior wash engineer with World Vision, and I'm joined by a number of colleagues and individuals who will introduce themselves a little bit later. So for a lot we're going to talk about, we're really hoping that this event is more collaborative and discussion based. Can everyone hear me in the back? Sue? Good. Okay. So we will start with about 30 minutes of intros, but then we will break out into some small groups because we want to start learning with each other, and then hopefully wrap up into some sort of summary that we'll distribute at a later date from this event. So the two main questions that we're trying to answer are, does my slide want to move forward? Okay. This is kind of the overarching question. There's two overarching questions for the event, but obviously each breakout will have a little different flavor of what they look like. So Jordan can't hear me. Okay, I'm gonna do this. So the first question is, what does quality wash service really mean? Right? I think we all have our ideas, we all have some assumptions, but do we have evidence? Do we have data to actually support what quality means? And it might mean something different to everybody. So we're going to talk about that. And then what are we missing? What's the evidence that we need to deepen our understanding of what quality really means? So we have different representatives of different disciplines here to talk about quality through different lenses. So this is just, again, a kind of a quick overview, and you can sort of see this is a snapshot of the different lenses that we'll be discussing. So start thinking about those four. You get to pick two that you can further engage with. And we're going to hear from everyone here a little bit about their research and what those discussion groups will focus on. So, but before we get into those discussions, we wanted to give just a quick overview of World Vision's journey as we broaden our understanding of quality and quality wash services. And so to begin, I'm going to invite Samuel Diarra, who's our Technical Director of Wash Quality and Innovation, to give us a little history about World Vision and quality. So go ahead, Sam.
Thank you very much, Adam. Good morning, everybody. My name is Samuel Diarra. I'm the Technical Director, as Adam said, for water, sanitation and hygiene, and then also innovation. I joined World Vision in December 2002. And from that time to now, I have seen World Vision moving forward with the quality issues. The whole thing started when we had our wash project in Ghana. That was 1985 to 2003. During that time, we wanted really to provide water for community, water to solve the issue of water scarcity. In that time, we were focusing on baseline, midterm, and end project evaluation. And that evaluation will give us, you miss doing this, and next time do this to make it better. So that was the way we were addressing quality. And then when we joined West Africa Water Initiative, we have added universities into the picture. And those universities actually were DRI, CFAD, Messiah College, and governments also brought in quality assurance and quality control, but at a basic level. Then after 2010, we moved to a higher level. We created a business plan. We increased our countries from 3 to 10 and from 10 to 16. So with that growth, the quality issue was posed as a critical point. So governments start bringing in their quality view, let's say view on the implementation. And then we created internally to World Vision an audit tool. And that audit tool was really checking about the processes, approaches, and also the implementation plan to ensure that we are taking care of quality in what we are doing. And then we brought in water quality, the community ownership, sustainability, all those components into it. It was better than the previous one. And then in 2015, donor visit happened in some of our region. And during those donor visits, they said, okay, we don't have the evidence, okay, the technical evidence that what you are doing is really good, but we want you to set up a kind of peer review system in which you and your peers will go through the system. Sometimes facility can be beautiful, but not good. Sometimes they are like ugly, but they are functioning very well and they are sustainable. But what are the evidence that it is working very well? And then in order to also control the innovation in World Vision, we developed what we call the innovation committee that sits around innovation that we want to bring in, can be technical innovation or approaches or processes. And this recently we did a consulting with Emory to do a survey to find out where we are with quality assurance and quality control. All those brought us to understand that for our side and knowing the level of involvement we have in our national in World Vision partnership, we need a quality assurance, quality control strategy. One element I want really to share with you, to shock probably some of you here, is the Ghana water quality study we are undertaking actually in Ghana. For the hand pump provision, for example, our suppliers kept telling us that these elements are lead-free, they are certified lead-free. But after checking hundreds of them, we found that finally the manufacturer lead-free may not be effectively lead-free. So we need a third-party certification, a control system, quality control system that should be in place to at least correct those kind of manufacturer mistakes or errors. So I'll stop here and give the floor to Adam. Thank you, Adam.
Thank you, Sam, for that intro. Obviously, a lot still going on with that Ghana water quality study. If you've seen any of the other sessions on lead, what UNC is also supporting. So now where we're going really quickly, and that will kind of lead us into our overview of these different discussion breakouts. So what we're talking about globally is not just checklists, compliance, but how do we change our culture, right? How do we create a culture of quality? Because without that culture, we're not able to reinforce those checklists and processes and compliance procedures that are necessary. And also without a culture, we cannot empower our staff to make quality-minded decisions, right? We can't control every single action that's going to happen in the field. So we've been talking a lot, Sam, myself, and other leaders, about how do we shift that culture? So some of the things we're thinking about, and if you join our session, you might hear a little more about, are this is from research that we've looked into, but some focal points as we move forward, right? So we have to make sure that our leaders, and that's a really broad term, but it applies to all leaders, that they take this seriously, that they're actually reinforcing this message. But the message itself has to be credible, right? It has to be believable and practical. And then it has to be kind of this employee-owned sort of grassroots movement as well, which is kind of contradictory, but it all kind of works together as one movement moving forward. So what we're looking at is some more conferences internally, some more communication around quality, and we're looking at recommended systems and templates to actually reinforce that. But really where we're starting right now is what does quality really mean, right? We're going to keep coming back to that question of, you know, I could ask everyone if I had the time, what does quality mean to you, right? And I think we get some very different answers. So these are some, you're starting to define what quality means. And I think I assume no one's shocked by these words on the screen, but would you actually design a water supply to be empowered? Right? Would you design a water supply to make sure it's actually equitable so then when two communities go to share it, there's enough water? Those are the things we're starting to think about and try to think, how do we do our designs differently? How do we engage communities differently so we can actually provide quality wash services? So that's enough from us. Thank you for kind of walking through our World Vision journey and where we're at today. But now I am going to turn it over to our small group facilitators to give a quick intro to some of the research that they've been working on, and then kind of a lead up to what they'll be talking about in their breakout. So Florence, I think sorry. Okay, forgot about this. We're going to come back to that. So Florence, you're up first.
Hey, good morning. My name is Florence Udenby, and I'm with the University of Toronto. And my supervisor is Dr. David Meyer, and we're really focused on intermittent piped water systems, and both in urban and rural contexts. And so when we start to think about installing piped water systems and how this is growing, especially in response to the SDGs, we know that there are benefits associated with piped water systems. Of course, they can make water more available and accessible, which can save time for women and girls, and also reduce the risk of infections. But we have to keep in mind that these benefits are when the water is provided continuously through the piped water systems. But the major challenge with many rural and urban piped water systems is they only operate intermittently, so less than 24 hours per day, 7 days a week. And this means that limited volumes of water are available to be distributed within these distribution systems. And when water is intermittent, there's chance for low pressures or no pressures, contaminant intrusion, so risk of infection goes up. And the pipes themselves, due to friction and pressure losses, mean that water is being distributed unequally or unfairly. So our research kind of was born out of this theory or idea that in non-piped water systems where communities maybe rely more on hand pumps, there's these social contracts or norms around how people get to go collect water. And maybe there's not enough water for everyone, but we've agreed that everybody gets 2 buckets or 4 buckets. And so then when we start installing piped water systems, those social contracts aren't the negotiator anymore of who gets water, how much. The pipe system is. And the pipe system doesn't care how much you need. It just depends on the physics. So if you're closer to the source or you have greater pressure, you have greater availability to collect water. Your neighbors downstream, there's little water left for them potentially. So this was our initial theory. And this simple model maybe is more recognizable in a rural context, but we do work in urban context as well. And we're working on developing or close to publishing a hydraulic model that actually takes into account the different factors of intermittent water systems, like that the pipes actually take time to fill. Then maybe you have some pressurized time and then the pipes drain again. And those filling and draining phases are not accounted for in current hydraulic models, but really affect how much water different parts of a network can receive. So like in this heat map, we see the darker colors are where it takes longer time just for the water to reach you. Even if somebody said you're gonna have 6 hours of supply, that's just from when we start the pumps to when we turn them off. It's not actually when every household has access to water. So we see there's certain areas in a network that may wait up to 40 minutes in this example to get water. And then also how long, once we hit turn off the pumps, like how long do you actually have pressure? And you need pressure to get water out of the pipes. And so different parts of the city have that pressure and that ability to continue to collect water for longer periods of time. So just sorry to jump around a little bit, but if we bring it back to the rural water work, a couple of our research group, including myself, went to half a dozen or so communities in both Zambia and India to start to understand how that theory of the non-piped water collection versus the piped water collection actually affects users. And so in all of the communities we went to with piped water systems, they did have intermittent supply. Like they were designed for 20 or 50 liters per person per day. So they could only run once a day. And it's just like a lack of supply to hit every household tap just due to that pressure in the system. And with the piped water supplies, and when we start to think about service quality and what users' expectations may be, we found that piped or non-piped water systems, people had more choice about when they went to the hand pump or when they went to the well to collect water. And they could go multiple times. And there is labor cost associated with that, but there's also choice associated with that. Whereas piped water systems are operated by a single person. And in some communities, there are water committees that are strong in like deciding when that piped water supply might happen, but that's not universal. Sometimes it's the operator and it's his schedule, not the community or the women who are typically collecting the water. And as I said, so with that, there's unreliable supply times and also just that limited supply to go around. We also found that piped water systems, you may think that they're being installed to every household, every premise, get its own supply, but actually there's a lot where it becomes sharing. And then there's social contracts within that shared tap that people have to decide who gets how much water, who gets water first. And remember, as a system is depressurizing, that means the first person may be able to collect more water, but as time goes on during the supply, less water is coming out of the tap. So we see unequal sharing. And also when we have those shared taps, the distance you have to travel to them varies between the households. So we're actually mimicking maybe more of the hand pump scenario than the pipe to premise that we were expecting in the design. And this can create barriers to access. So with all of that in mind, as we think about intermittent supplies, particularly in the rural context, with that lens, in my discussion groups, I want to think about service quality, but in terms of, are these intermittent pipe systems meeting the goals or our hopes as associated with the SDGs? Are these shared taps or shared stand pipes the best of hand pumps versus on-premise supply, or maybe the worst? And how do our demand projections actually reduce our service quality in these intermittent pipe systems? So, thank you.
Thank you, Florence. Next up is, Emily.
Thank you so much. My name is Emily Ogutu, and I work with Emory University. And so I'm going to talk about our program, Strong Women, Strong World, which is being implemented by World Vision. And Emory University comes in as a learning partner. So we do research along implementation of Strong Women, Strong World. So Strong Women, Strong World is a program being implemented in 4 countries, 2 in Central America and 2 in Africa. So in Central America, we are in Guatemala and Honduras. And then in Africa, we are in Zimbabwe and Kenya. So Strong Women, Strong World focuses on empowering women and girls through WASH and economic activities. And just to mention, this is a 3-year program. It started in 2022, and we intend to complete it in 2025. So it's still work in progress, and a lot is still going on. So to inform our learning, we've looked at a number of studies which have been done out there. And in all these studies, we find that there is still need to do more research. In terms of they still need to do more research, to do more of monitoring and programming, which are targeted or focused in women on women and girls. Just to give an example, in this meta-analysis on water sanitation and women empowerment, The research has found out that there's still a lot of gaps or need to do programming which are targeted to women and girls. So yes, there are a lot of programs out there which are targeting gender and WASH, but then they're not specifically targeted to women and girls. So we still have, they still need to work on that as well. So based on that, we as Emory University came in to work with World Vision on the Strong Women, Strong World, and to see, look at how World Vision is executing Strong Women, Strong World program. And so the objective of the Strong Women, Strong World program, or the objective of our learning, was to understand the impact of WASH and economic activities on women and girls empowerment. So how do we do this? We started by conducting a baseline survey, which informed the current status of WASH in these countries that we are working in, specifically in the area programs where World Vision is implementing. And then we intend to do a midline and baseline survey just to help us track change. We also did formative work where we wanted to understand and gain a better understanding of the context within which the program will operate. And this is intended to help us identify the barriers and facilitators to program success, specifically on barriers and facilitators to economic empowerment. And this learning would then help us to provide specific context recommendations for the program. Secondly, we are also doing process evaluation. And in process evaluation, we want to see if the program is being implemented as it was planned. And this will help us determine challenges and successes in program delivery in each context, as well as to learn to provide recommendations for future delivery in these countries, across countries, and even in the whole globe. So that is a summary of what we are doing. If you would like to get to know more about Strong Women, Strong World, then yeah, I can link you up to. I can link you up with Christy, who is here, who should be able to provide more information, especially in terms of the implementation aspects. So in our breakout session, we will look at the conceptualization of empowerment, because again, people talk about empowerment, we talk about empowerment, but we really don't specifically mention what we mean by empowerment and in what context. And then we'll also look at the key domains of economic empowerment and how all this relates to the interventions that Strong Women, Strong World is implementing. And just to mention, one of the some of the implementations are related to water. And then we'll also look at sustained empowerment, because again, we find that programs go out there, we talk about empowerment, but again, we don't look into the needs for sustaining this empowerment. You'd find, for example, that a program is out there just to provide education on a certain aspect, but then there is no follow-up on seeing if this information is being utilized the way it was intended. And finally, we look at the remaining gaps in terms of empowerment. Thank you.
Thank you, Emily. And next is Robert, and then I'll close this out before we break out.
Cool. Thank you. My name is Robert Dreibelbus. I'm with the London School of Hygiene and Tropical Medicine, working in close collaboration with the Malawi University of Business and Applied Sciences at MUBAS. The PI on that is Kondwani Chizuwazano, so he's sitting over there. Couldn't all fit up front. What we're talking about here today is the relationship kind of between quality And this idea of resiliency, particularly in the face of climate change, or that's one key aspect that we need to be considering. And we've talked a lot, or we've heard a lot about kind of what the new kind of Anthropocene means for resilient wash services. But I think most of that conversation has tended to focus on water supply. We've been working with World Vision in a district in Malawi, looking at their sanitation and hygiene. It's working over the course of the next 3 years, district-wide, kind of full district-wide coverage of improved sanitation and hygiene facilities. And we have a little bit of preliminary data. So this isn't the prettiest graph because we just got the numbers this morning. But walk with us through it. What we have, this is part of the project. Baseline data were collected in Q1 2022, and we saw within some of the traditional authorities, which are the fourth level, something slightly below district, so whatever number that is. At baseline in these districts, it was the first round of implementation. Prior to that, actually had 100% coverage of basic sanitation within these services during our kind of the baseline survey. So this was verified facilities at the household level. So fantastic. And this is kind of the rollout of the intervention over time. There's some animation in here. Okay, so sometime before the end of the year, these two traditional authorities were declared open defecation free by the district government. So there was verification of this open defecation free status across the political system. Cyclone Freddy happened in early 2023. I think it was through March. It is the longest lasting and most energetic tropical cyclone on record. Thank you, Wikipedia, for these nice little bits and pieces about Cyclone Freddy. But importantly for the study site for this district, it resulted in severe flooding and landslides. It kind of made, the cyclone made its way inland and just kind of hung around Malawi for an extended period of time. Massive flooding, massive landslides, and within Malawi, it's estimated deaths of about 1,200, another 500 are missing and presumed dead, so really devastating. But as we, without turning this into kind of a doom and gloom session on climate change, this is our future. More things like this, these severe weather events that are going to be longer, out of season, and we need systems to do that. So what does this mean for sanitation services? Sorry. I tried to use the JMP coloring for this. So we started in 2022, the early part with 100% improved coverage, or at least basic coverage. So at a minimum, a pit latrine in a slab or something better. By 2023, in the aftermath of Cyclone Freddy, only 18% of households still had basic sanitation services. Another 46% were now using our unimproved services. So these kind of basic pit latrines without a slab. So those very basic ones that we know aren't at JMP standards are kind of global quality measures that we're using to look at sanitation facilities. And 36% of households have no facilities. Now, granted, this is a relatively soon after the cyclone. I think the data were collected about 3 months after the cyclone, but still, so there could be subsequent improvements. But what is this saying about our kind of current approach to sanitation, where a singular event can effectively wipe out all gains that we're making in terms of increasing coverage and increasing quality coverage at the local level? So that's our data. Yeah, we were interested to see it. I hope you are too. So in our group, we're going to be talking about resiliency and what does this mean? How do we define resilient wash services? How do we engage with those, and how do we plan for those? So yeah, so hopefully you can join us and be part of the conversation. So thanks.
Thank you, Robert. And I'm just going to go through quickly ours for the sake of time. So Samuel and myself will be leading the final breakout. You already heard from us, so I'm going to go very quickly, but we are going to focus on what does a quality focused supply chain look like, but then also thinking about water quality monitoring and kind of a corrective action planning process, and then infrastructure, quality assurance, quality control, What do we need to do to understand it? We'd love to hear from you. If you have experience implementing any systems or programs underneath these 3 items, please join our discussion and we'd love to learn more. So, whoops, sorry. We're not there yet. Oh boy. Okay, we're right on time, almost. So we are going to break out right now. We have 4 corners of the room. We have a whiteboard, and then 2 easels. And anyone have a preference for whiteboard? Can I just assign you? Okay, so we're going to do, Lawrence will be over here. So that's on equity, intermittent water supplies in the front of the room here. And then Emory on empowerment and inclusivity in the back whiteboard. And then Robert and Kundwani on resiliency in the back easel on the left. And then Samuel and myself on quality assurance, water quality will be here to facilitate the breakouts here. So we'll have about 20 minutes to talk amongst our groups. We have some questions that we'll be discussing. I'll remind you when you have a brief break, and then you get to pick another session before we're over, and then we'll wrap up and kind of hear some takeaways. So sound great? So, thanks, everyone. Is this my copy? Yes. Okay. All right.
Yeah.
Are you doing that? No, all right, I'm just.
Yeah, so thank you all for joining us here. I think, I hope that we have some interest for our work.
Since we're somewhat of a small group, do you mind just giving a quick maybe name and organization? And if you'd like to share your experience on
But
quality.
like, the goal is just to have an informal discussion around these ideas of.
We already talked, so.
Okay, I'm right now. I'm working with yours. I think that's
There's not very many of us.
Finish the second year in the program. So they like.
With maybe organizations.
Thanks for.
About water.
Whole system.
Yeah.
And we do a lot of.
Urban or- So I.
We have to share, but unfortunately.
That's good.
And
Yes.
about rural wastewater in probably the last 2 years. since we started my seat.
The director of good
Maybe
and
or-
had a lot of maybe got water. Was this? I think she's here. I've been in water for about 15 years. Primarily household water treatment solutions, also drinking water. As usually.
And I said, oh,
Yeah, sorry.
Right. So I heard water quality, QA/QC, I know I was involved in everything, but QA/QC is big too. So the three topics we had talked about were quality, focus, supply chain. As I guess I want to start with understanding where people are, and then you, has that comes up more formal, where you're trying to think about the products that we order, the materials that we order, are they safe? You know, not just, is it, you know, not just are we testing analyzing water for bacteria, but are the materials that we use?
Specifically about
Anyone want to share experience with that?
water and samples and conflicts. So we are, most of our water filters using the the French company
dynamic
pump system. And we work with them to ensure that they have some failures. But I say like most issues with the procurement process from the village to the mechanics, to the retailers, and then back. And then we realize that it's not the original supplies that we get because they're their type of supplies. So it's not the quality of things. But at the same time, also the mechanics were, maybe the supply, the spare part was good, but the mechanics is not really so. There's a, you may really like list all all the different types of parts, but we might not necessarily the needs for that breakout at the pump. So now the issues of water. So there are many multiple issues until we really get the good supply of spare parts, quality mechanisms, and the downtime during the break.
So if I'm hearing you correctly, when you procured originally, was a it was measure specification, but it's the post-construction repairs and replacement that introduces some quality. Okay, so I'm just gonna write, I'm just gonna take some high level post.
your farms that would have multiple stores, so it's the first to drink water.
Thank you all for sharing. So I created some discussion questions, so it's totally fine to move away from those. So that's what you want to do. But to start, I guess, I wanted to think about, so the fact that a lot of the rural pipes, even if they're driving the side, they're only, that's like I said, 20 or
Really bringing up everything that's led right now is bringing it all.
so maybe in a minute. And if we have a confidence that the water is flowing to.
Yeah, for example.
Or the GFP, like safe and managed water is, you know, the top tier, the level we're trying to get from the on-premise, available when needed, and the region to contaminate.
Get the storage.
But intermittent water is not pre-commissioned. Available when needed. Very good. Question. But we technically check that on the premise. So I guess the question that I have is like, what is quality service?
Yeah, it's really.
Is it if we only have safe water? Is it just imported water? Are minimum volume? I guess like. But maybe we should start what is quality service? And I guess nobody is up to stuff down. I don't want, we can't end with Mother Nemo like Sorry about that.
So it has to happen. So then you would find yourself compromising on the quality of work that you don't have access to, not in the way you like. Not just the hardware side.
Intermittent supply and unreliable supply. Service, like that is not. Huge, really hard to keep, probably get.
Yeah, right, so.
So it's not hardware.
Quality water service and reliability.
And is that?
Yes,
even if it's
also
intermittent,
within the work. Yeah.
intermittent, or?
I mean, honestly, in context, like people know that the water is gonna be on from, 8 AM to 10 AM. And they know that. So
Yeah.
I wouldn't say that's like our goal, but.
When I recently visited to Malawi and Zambia, I think every pipe water system had a dispenser. When I asked the question, has it been replaced? I kind of got this like replaced, what is it?
Like, say reliably intermittent, like, reliable.
Any other?
Intermittent schedule, like, you know what I mean? In all honesty. They know what day of the week they open the tap until they're tanks or whatever. Not great, but.
True in a lot of places, but I think it's also true in just internet. And as you said, the way these things are designed, it's all about the pressure. So you're trying, you're designing it so the pressure at the end point, is the same pressure for the beginning point. And everybody taps in. Illegal. So, the governance is so important. Just like we did, everything was governance, everything. And we also had a fee where we were getting licensed for 20, 30 years. All of those things. Plus you can solve the value of water. The water.
And I think one of the challenges that we're dealing with, so about, what we're dealing with,
In my opinion, it's better than.
internationally, or kind of from pre-vetted,
I would not call it.
relatively easy to do, right? If you wanted to find someone who has some certification for material, wanted to get it down. Reaching out on the field level, where like, a lot of our teams have relationships with so what we're asking them to do is essentially resolve these relationships and procure from America. And that can be, that
I heard.
doesn't always sit well.
Like,
So,
you know, when you.
so I think the question that I've been thinking about, and I'm curious, but how do we build the capacity of local supply chains?
Yeah.
So maybe it's not, we do it all right, but how does that capacity get built?
Anytime anybody goes in the work, I'm not saying it's not bad, it shouldn't.
You think similar pressure?
Well, ideally, in a system, if I'm not mistaken, pressure at the end of the same, where there's that breaking in.
It's going to turn into, that's too difficult and we'll find out what happened. It might sound strong.
Really, so it's like that's.
Any thought?
I don't know, question, but yeah.
Yes.
I mean, it was.
Regarding that last point, including the capacity of the local supply chain. After the change we had in our different regions, some national offices
But I feel like we're saying pressure at the end.
and the market, manufacturer, representative, and suppliers.
Goal to be like.
To have the one thing
May not be
on our supply chain guidelines.
They have it, it's enough to like for the needs.
Now we are doing this now to speaking the law in terms of implementing the supply chain. So having this capacity building locally between the institution and the market people is very key.
To like, depending on elevation.
There is
like,
also a lot to be done, I would say, when it comes to the,
maintaining similar pressure.
on the policy side, as well as, you know, like,
Becomes a really big challenge.
kind of like, there is no imposter. Let me put it, we might, you know, ask from here, or, you know, like international organization side, we could advocate. But we probably actually start looking at times we also require that we, the case on themselves. But if I am in faith, just because I have a project, like they have to follow a certain policy. But if they're not able to play, you know, with a certain like, which doesn't really, you know, adhere to the quality.
Like these guys, like this level of professionalization.
We definitely create an issue with those
They respond to any like.
whereby the, you know, the legal or the policy. The enforcement of.
Yes, in Malawi, there's a court system everywhere.
They don't even exist, you know, like the. in this
What
case,
you
the
see
government
is all the outside
or
breaks down.
expecting that.
The middle section.
So I expect
Those who work for years and years, everybody has last word, all the.
would mean like, putting ourselves because of our quality expectations.
So,
From.
you know, if you have the option.
That also is an engineering we got see the kind of affecting the local economy.
They're working higher quality.
You know, and, expectations. So the reason why I'm saying is unless I find out something when that's by the enforcement of quality, they got friends of police like application. You know, to the policy they can follow. I think it just gonna be. We've seen it myself, because myself and other, we've seen it, you know, one project our time like that. We talk about certain things, but that's not really important. I just,
About framework, I feel also norms and standards for each of the different water quality, construction, post-construction, who can be suppliers. So on that level, we can assist the government, work with the government to have those kind of norms and standards. But also the NGO, so we the one who's demanding those suppliers. So our supplier, which is a completely different department than the program, should be also have like a list of what are the norms and specifications when you purchase. When you purchase what happens when I was in Congo, and there was a cholera outbreak, there's no time, you have to purchase what happens, but where and who and what are the specifications. And not only that, but what are the shelf life? How do you store it? Where do you store it? What the needs to ensure that it's still a good. But that's the demand side, but we believe also the work of the suppliers side also important. Those small suppliers really wants to learn, they want to improve, they want to study more benefits, but they don't have any guidance and more. So I think as a program that they starting to implement in an area, you need to look at those, the governance standards, your own supplier, but also the supplier education. So that's really nice.
And we just definitely
Whatever it is, right?
groundwater level water scarcity. But are we designing any systems to run? Like, I don't know how much yours has been our design for, but the World Vision Expandia is 20 liters.
And that's what we've been trying to do.
They size their bore well
It might
for
cost
that.
a little bit
and
more.
only that.
but then you're not externalizing those costs on the
Also, I guess
community.
the
onto the
question,
government.
especially.
Right, so pay 25 cents extra. That means that the community doesn't have to pay a
We
dollar.
start to hear about like aspirational for water.
Yeah, so, but that's a hard message
Having a
when,
garden.
especially like, even the way World Vision is set up, right? We have our support office that says, here's some funding to do X, Y, Z. We have these teams that feel like, I got this, I have to do it, and I have to use this money effectively to
Downstream,
provide
they're
the impact
no
that I
longer
said.
better.
So if you're asking me to do
Per
the
day.
same amount of work,
So
but a little bit more money,
I guess
then
I
we,
want to.
as leaders, need to say, yes, and
Quality and like what are
yeah, if you
management,
go over budget, that's okay, here's how we're gonna.
is it
Right, if we just say, no, figure it out.
fair or colonial or whatever, if they know you only get 20 liters per day versus like what is it that you hope your water will survive
I was
each year and
in the
can we develop demand
market and work with supply chain people.
aspirations for like multiple uses?
Came out that was actually very essential. Is that the quality we are looking for is not a demand in the market, and the market move according to the demand. If the demand increases in terms of quality, the market will fall. But for the time being, the raw material
options to have
with demand.
Yeah.
So we have some suppliers who want to meet that.
meters and they go.
We will start providing the quantity we want.
I would agree with
Quality
what,
we want. But actually to ensure that the market will be requiring those qualities.
Yeah, it doesn't matter what system you're using.
We are, over time, I'm gonna let it go a little bit. Did anyone want to ask a question? We all, I know we think we covered one smaller topic. Do you want to talk about water quality in particular? Or?
And we're interested in looking at.
With this area, from what I've noticed is when you have neighbors, some people try to shout about, and then like, if you open the water, right there, the water might die. We fell down. That's how some people like having. We've talked about an aspect of it. There are certain communities where there's like, if you trust and I think that's something like certainly large reduction.
Maybe just going back a little bit to water quantity, that is a really challenging thing.
This minus parts of that.
We're planning based on 20 liters per person per day. Would recommend so I think one system that Cambodia partner earlier this year, we had system looks at pilot data or installed people were actually using closer to 100 liters. I think that helpful to you using data right through. It designed a system based on recommendations. These are behavior. And in that case, I think that was liters, so people are
Great. Well, I'm
we're
gonna
happy to pay for that.
switch this. I will offer that. I want to stay and continue this conversation.
We would like to design a system based.
All right, sorry to interrupt everyone. We're over time. If you want to stay in your group, that's okay. If you'd like to switch, you can switch. I'm gonna let you decide what you'd like to do, but we're gonna switch if you want to switch.
Yeah.
What we're doing right now is the whole idea, hey, we need to have. So actually, and I can give you,
Great.
I'm leaving.
Yeah. Especially lately with that CSR. The best way to get objects into that program is I've got some CSR. Larger option. And then actually.
I'm gonna say here.
Someone does it for you guys. Make this happen through part of that. Anyway, I didn't get
Everyone here, safety liability. You want to come? I want to make sure we're. We all kind of expect. It's not.
Services, but last year.
So our last, this is kind of saying what we talked about last year. We talked a lot about the procurement process of materials, but not just procuring them. Procuring them, and then after that install, does the local market have quality materials to support the rehabilitation of materials? Then we talked about how do we build capacity with World Vision and suppliers. One of the challenges we face at World Vision is when you ask globally to our teams to only procure certain goods that meet certain standards, that often means they are unable to find that issues. So they have to then procure internationally from Europe, so we're figuring out how do we work with to do that. Part of that is having government also understand develop regulatory frameworks, enforcement around that. Recap from what we discussed previously. Any thoughts, reactions, questions to that discussion? No, we nailed it.
Tell me about the chlorine came in and the consumables.
Well, that was, yeah, so in addition to spare parts, we're talking about other, chlorine was an example of making sure there's actually chlorine in the market to support. So if we build a pipeline system,
Really,
we have
my goal is
coordination, placement of the tap or some other. Start getting reporting.
big water supplies and what like
In
good
the local
quality
market.
service.
Or can we provide enough chlorine that's stored safe?
So.
It's been a year.
Just away from my own stuff. I guess we've got us started.
Or
I-
stall, some technology.
Yeah,
Big
that's true.
supplies that run.
We're experimenting, I think, in there.
When the big water supplies are tapped for every.
Well,
I'm wondering, so I'll share this.
We're about to-
And like the GMP level of.
Trying to switch things.
On this.
So a couple of things we've been thinking about. One, just general.
But then when we compare it to like TPE files.
Effective. Also, it's not. Sam mentioned the study we did about not just bacteria, but.
And so. With
metals,
intermittent
lead,
water supplies,
so,
what is quality
I just
service?
want to post a question to begin, but do you have, does anyone here have experience with water quality monitoring program development?
Just like so.
Specific,
I guess.
lead would be a
that's where
bonus, but
we'll start our
I'll leave it there for
discussion.
you.
And we're, as
You
you.
have experience with developing water quality
So-
programs.
You share your ideas around like what good quality service means in terms of pipe supply.
So you're an expert.
Things down.
A little bit, yeah.
not lead.
Anyone wants to start?
So what would you typically be monitoring?
about defining these along more quantitative lines or qualitative?
Well, you know, in the protein side of it, what I think we're working on beyond
I think,
bacteria
as I said, like,
depends on.
is
what's the
safely managed water, good quality service.
indicators, so
If
we're
some
not
level below
developing
that, good quality.
beyond that for the other.
And then I think that would become a discussion with you around quantity.
That gets a little bit more. normal. So
What are you thinking?
it's all about what other conditions,
I
right?
don't know,
And just,
yeah, I
just
don't have,
bring me up to speed, is this your core or is this after the cycle that came through? Difference to, in response to disaster versus.
This has nothing to do with cycle.
Throw out an initial.
Yeah, no worries. But it's a good point. I mean, I think all of this is relevant to, like, all of these topics are intertwined, right? We're not just gonna talk about it. But if we're monitoring for something in a cycle, does that change our program? Does that change our procurement process? You know,
Well, it's relevant.
but we're talking in
So
general.
it's kind of a starting point.
And I think,
Discussion that is.
okay, so microbial.
Fluoride or arsenic as well, so, you know, those are the key ones, yeah, just.
It's a starting point.
Which is pretty simple.
What are we thinking about this?
Really normal.
This idea that intermittency means
And I think
quality.
one of the challenges I've seen is, if there is obviously one single GC like available, when there's sometimes a retest, but often it's just it's abandoned that well. And then, so I mean, not always, but sometimes. And so we're trying to think through, is there a more thoughtful approach to water quality monitoring where we can actually
Yeah, that was my question.
understand the chemistry in a way that's still safe, but recognizing that groundwater especially is depleting. And so abandoning a well that might be ideal is not something that we take.
Tell me if I missed that. I don't want, you know, I cheer.
The other thing looking at is anyone monitoring for functionality. Work with like me. Okay, and is that just sort of usually or like when you're there or? Yeah, I think.
What you said, I think translates a lot in Latin America, Central America. It's like even most things are like in the house, right? In the house, usually there's a large basin next to the tap where they're every day, however many hours that water is running, they're usually using it to fill that basin or other sources. of data, so that they can have water available for the rest of that day. And so I don't know if it's often an issue of quantity, I'm sure that comes into play. It seems like most people. Sometimes they can have hours, like this set of households will fill between 10 and 11 or 10 and 12. This set of households will fill between 12 and 2, like it's organized and everybody's getting their water, but it's not, everybody has access all the time to like a running water supply. But I think you mentioned it in importance in your presentation, but another thing to bring out here is that quantity aspect, because I do think a lot of systems are still designed to meet minimum standards of 20 liters per person per day. But when you have that pipe water, I think there is an expectation. And I think there's also a lot of opportunity there to improve the use of water for other uses and other things. But the design has to be there
Setting up that planning and that logistics, and so also what is the longer term?
you know, depending on the
I think
environment.
it's sometimes in development projects, but in the emergency side as well. And we have shots like that, what is feasible? for
Other
longer
types
term
of
plan.
productive uses or.
So we did some work for the previous project period, so developed a
You
and now they're doing some seeds here.
As an engineer.
It's exciting some case studies. So you can see your provision or others as well. Because I think that's what we heard from partners is that having cost that out, having planned for it. and that can be a barrier.
Yeah, well, and one of the things on the non-emergency side, like you said, it's a little bit easier. But we also are dealing with, once that system or water point is built, it's handed over to the company, right? So we essentially lose control of water point. And so we're trying to figure out what can we do though to continue monitoring the post-construction functionality and water quality that's respectful of the government's obligations to also be doing that, you know, sort of walk alongside government. And so it becomes a little more tricky, right? When you develop those.
I want to be
Emergency is kind of different.
the associated adverse, because you're also thinking about the water and services affect our ICL quality. And what is that, what I mean is, let's say that there is a community that has
All right, well,
the water access is intermittent. And during those times,
the final
isn't water flowing.
topic, so
Then there are
what's on there?
being
Infrastructure, all the assurance.
of the water, or maybe it's like a higher.
That's something I spend a lot of time on, myself.
Is that
And so.
versus a
I wanted to
community
talk
where
about
that's
that.
not occurring?
If anyone has experience, do we have any
How we can
engineers
solve
involved in water, or who's an engineering background?
Yeah.
Oh, yeah.
Right, and
When we
there's.
think about infrastructure. all insurance policy,
Or if there's a.
There's-
Culture around.
But,
Maybe of using the water.
what comes to mind based on your experience? And we all bring different perspectives.
And if it doesn't exist
But
within
I'm just,
another.
I want to understand where everyone's coming from. When I say infrastructure,
Removing the
quality
assumption
assurance,
that
quality
it
control,
is
what does that
not.
what words come to mind?
And yeah, how that looks different.
We're just trying to develop our own quality assurance framework.
And
an
like
organization
maybe
for WASH,
community
and
culture.
looking at the.
I'm not sure, along those lines, I'm trying to figure out the right, like.
Guidance notes and checklists based on project
Yeah,
cycle,
maybe.
so at design stage.
Culture or attitude or norms around how,
And giving
how you interact.
an envelope of parameters within which to work.
So I think
Everything has to be contextualized, you know, you're working within government regulatory frameworks in some instances and not in others.
use of water should be,
That's the way we're trying.
are you thinking
Is
there's
that a
equal,
QA
everyone's
that's a QA
getting
QC,
equal amount of water, so.
Yeah, if it should be asking what you. Right, if it's like.
Yeah, that's different
That's
stages
not
of the
thinking, and then you're getting off more water, then
application, commissioning.
is allotted or unreported or, and you're using the.
Resilience, maintenance, and critical control points. How do you identify where your weak points are? How are you gonna maintain those to make
I
sure?
know there's this kind of operational, it's like one of those.
Yeah. How you do that about like.
Well, ideally, you train individuals that would then be proactive to be out and in the system, so that you're not relying on individual reports. So it'd be kind of setting up this, that this needs to be monitored. Is
Maybe.
it above ground, below ground? Is there other kind of influences of illegal pathogens, drinking water, wastewater?
Is there room
Infrastructure?
then for like?
And really developing a plan of action
Demand.
that would allow for accountability so that someone is actually monitoring and being proactive.
People, like, taking more
Seems to
water
me,
than
build it and leave, then
share,
it's not.
and,
Yeah. Any other
they're
thoughts on
actually
your
able to
design?
practice
for
water.
Contracting, so RFP, the language that's in the contracts and supervision.
Yeah, no.
All the data that needs to be used for drilling and construction. Right, so I think along the way, also sometimes time payment to quality as well. You know, period of time after infrastructure is built. So I think a lot around, unless you're a lot of in-house contracting. With the infrastructure, it's that ability to ensure quality control while not directly doing. Do you do a lot of revision for the infrastructure work yourself, or is it? subcontractors?
We do, both, depending on the carrying water.
I think water is use and working very much. I mean, you have to overlay, you use it to any infrastructure, feasibility study, all the way to commissioning, and you wouldn't need then after you have to have that as a built into operation in maintenance, built into.
Thank you. I think
Like,
the way
from
we
the
started
life
to think about
cycle.
that is like aspirational water, just like
So it
beyond
would- I don't think it's a
the
one
basic
time
drinking
thing.
water hygiene or domestic use, like what are your
You know,
considerations?
starting
Right,
from.
like
you
water
concept-
feels more
conceptualize the
available.
whole
So
thing.
what more, how can I further improve my livelihood by the access to this water?
I've been kind of thinking
But
that
going back
quality
to
design
quantity and like,
is
what have we
empathy,
designed the system
right?
for?
And
If we've
thinking
only
about
designed it for
how
20
is this actually
liters per
gonna be
person
used,
per
right?
day, that's like
Who's gonna be
very
using it? How will they use it?
strict,
So
like drinking water.
something that I've been thinking about is could we have our
So now if
designs,
someone
when we design a
has
water system,
aspirations
could
for
that be
carbonation,
reviewed by a local
security,
or
and they're
contractor,
close to the source,
or
they may be able to
you know,
drop.
and actually in the design phase, give feedback to say,
But
I can't get
unfortunately
that
now the
size
downstream
part,
receiver
so can you change
is not
that?
doing 20
You know,
liters.
simple things like
But
that
is it,
to actually go a long way in
is
sustaining.
it problematic
Or
that
sustaining
they
kind of
aspire to greater water use? You know, it's
But-
not like it's waste.
Yeah.
They have.
How do you get a scale of that?
Very important.
If you're going beyond one community, how do you
So-
systemize that approach there? Right,
Can
that's
think-
part of the challenge,
Talk more
right?
about quantity or
You
Yeah.
want that
demand
feedback,
or
but
what.
for every time you want to go to.
What can we do and there's things about water?
So there are certain parts often regionally they wouldn't be available. Probably regional standards.
Yeah, and then I don't think you would learn to what I mean. I mean, like, so the police say, okay, I understand that down there. But you would get it in a minimum, you know, like you should work. That would be in a more in every context. I like, so one would learn again, standard where you will say, most in urban, no way you make that. Okay, that's for understand, like, you know what I don't say, empathy. The more you report the way, continuously when it comes to making our infrastructure, disabled
Yeah, I think this is really
disability friendly,
point.
no.
And then
You know, like,
just to add
the
a
whole idea of like,
complexity, like what is the equity of that? It's not to say that water services don't need a financing mechanism, I'm not saying that, but households that can afford more water can better their situation.
But
But
it
it
can
can afford more water too, but
And I think it's.
I think it's
this is
a
really,
good point.
it's a big discussion because there is this push for scale, right? Because there's tremendous need.
Similarly, for
Right, so.
on redundancy or
when we design a
storage
system or
to
program, we want as many people.
fill in
to
the
have access
gaps,
to that and we want to
there's
scale that.
resources that are required.
But the question becomes, is that scaling, rapid scaling worth it? If we're not able to sustain the quality that we want, right? And that's the balance of, no, we don't want to just focus on one system for the next 20 years and say, we built this thing to be.
Wanna give
for
you
art. But there's some sort of middle ground there where we have to be putting the right due diligence in the systems we design. How will we scale? And it's gonna be some pushback, right? I mean, we have people who want to see impact. I want to see impact, right? We want to see that we provide impact, but I think it's going to require changing our definition of impact, right? To beyond just providing water, but actually sustaining. Which is challenging.
It would, that world vision, where's the line for you guys and when you do those evaluations locally or regionally to find where the crossover points are in terms of materials that they have access to? But then maybe there are ones that only 60% have access to, where an organization the size of World Vision could maybe step in to establish supply chains for those items. Maybe 40% are lacking. Have you guys gone down that road before?
A little bit. Do you want to speak to this at all?
Yes. In World Vision, actually, we are trying to get minimum standards.
What's the cost benefit of that versus
Which will actually allow our program to continue to make impact while we are not compromising on some items. One of them is lead, for example, lead content material we're talking about. is to have them in our system. As the governance system, for example, we are not negotiating different at all.
What's the
And the water quality, talking about physical, chemical, and
cultural norms or
trace element as well.
that
We are
just are
analyzing
associated with like, well,
element. And
just
if
the way
there
it's
is
always
any
been, when they're not always available,
we
so
are
why
making
make it all
the whole on hold.
there might be
not
other factors
on
associated with, well, if this person, even if it is professionalized,
sometime during
right, you may have somebody who's being paid to operate a system, but maybe they're not being paid enough. So they're having to supplement that with farming or another job, so they're not able to come and keep a water source open. or available.
in most of the cases.
It may be designed, it
Community
may just not be.
engagement, community
What do you
participation,
run
having
into
the
in most
idea there
communities
is
that not intermittent
and
water
government
Yeah, so I
guidelines
think, yeah,
and
there's-
standard.
I would say two
We
main
want to really
categories.
to ensure that they are the standard.
So
in
on
our
the
program.
design side,
All the rest is negotiable.
maybe the pump can run longer.
And I
But
think
the
Sam,
storage-
you mentioned last time that, so we recently Sam provided training on, we have our own procurement guidance that we sent to all of our teams. Sam did a pretty intensive training
And
with our
so
teams.
the,
After that, many of the countries held their own trainings with local suppliers
That's my
and
cutoff.
government to say.
I
"Here's
turn
what
the
we're
valve
doing.
and I let that flow by
You need to
gravity.
Come on board, basically.
The water
Kind
is
of build
out.
that capacity.
The
So in
water
that
is
sense, we
like-
are trying to build that. The other thing I'll just mention briefly is in
With some,
the water quality study in Ghana, we're doing, looking at lead.
in India, at least,
Well,
they
we
may.
did realize
try
that
to
all
build,
the hand pumps that were lead free,
storage
are not truly lead free
But it-
through our own testing. But we worked with
Design-
manufacturers to custom develop
Volume
stainless
and
steel
also,
part
like,
that would
the
make it
norm around
lead free.
operating
And we're testing that right now to see if it actually makes a measurable difference in
Today?
quality. And if it does, that's something that we're gonna
But the
potentially
other-
say, we need to start doing.
Also another
hand pumps.
design
Because the
issue
cost
of
actually isn't that
the,
high, it's a little bit higher, but it's a couple.
also
percentage
limiting
points.
how much you can
So
withdraw.
that's a way where we could potentially,
A lot of
a way to say,
Yeah.
hey, here's what we learned,
Increasing
here's what we're doing, everyone else should do this too.
water is harder, we can get.
I'd
less
love to hear
out
more
of
about that after we
afterwards.
get wrap up.
But I don't know that we're trying to connect.
Yeah.
We have the that, we have also the that.
Are you guys developing it or is it on the market?
Like,
No,
They just made 30 for us.
Oh, wow.
And so we're testing them, we're about to go collect samples. We haven't collected it yet.
the most interesting thing is
Myself.
it increase the cost by 2%.
Yeah.
If you compare to the quality.
But yeah, we'll be, hopefully next year, we'll have some data to share on that.
On the social.
We're gonna wrap up. Thank you all so much for your. All right, everyone. Wrap up in 2 minutes.
Yeah, I'm glad to sit in on that, Adam. We met, I don't know how long ago.
Yeah.
On a business deck. Like water and, yeah.
Yeah.
Good to hear you.
It's, So we used to think of it as yeah. Actually, I have like. Bring us back, bring us back. Everyone, hold on, please come sit. You have 5 to 10 minutes for a quick. I'll catch you, share. Somewhere, are you in the? Oh, I can just have the facilitators come up here. Just forward to ask.
We all. Yeah.
All right, Barbara, can you come up? Or can Lonnie, whoever wants to, we're just gonna give a quick, like 2-3 bullet summary of some of the discussion points from the group. I hope that was engaging for everyone. I really appreciated our discussions. Thank you all for coming with questions and enthusiasm about these topics. Like I said, I'm hopeful that we can kind of summarize what we've learned here into some sort of document that we can share with everyone. But with the time we have, just in the same order, Lawrence, can you just give a couple points? You can use the mic or you can just yell, whatever you want to do.
Usually my voice carries, so I think. So we really discussed intermittent water supplies and quality of service around those. And maybe the initial thought is IWS is not good at all. But then we started to have a more nuanced conversation in each group about maybe when is it good? Like, is there a predictability? Is there quantities of water that meet users like needs or desires? That could mean IWS is a quality service. But yeah, there's a lot of nuance to that, like talking about water quality itself, like do we need point of use devices or storage, qualified operators, and what's the affordability or around water in these systems. So really briefly, that's what we discussed. Thank you everyone who came to have these discussions with me.
Great, thanks, Lawrence. Emily, you want to give it?
Yes, I'll pass it to Perry to share what we discussed in our group.
Hi, I'm going to try to project from here, so let me know if you can hear me. I am representing the equity and empowerment team, the first half of the discussion. So we talked about some key parameters around equity and empowerment. So the ideas of agency, dignity, and sustainability. So in the second part, apparently some ideas about being able to voice one's expressions, opinions, both in public and within one's household. And so one of the key ideas that resonated from the group was that when these parameters become the norm, these then become sustainability. So that's how we sort of operationalize sustainability here. Then the idea again of taking a systems change approach, building on existing social networks and involving communities from the start and designing these programs so that they don't become siloed and just a program, but really do have systems change are crucial for sustainable environment within communities.
Awesome, thank you.
Thank you, and thank you everyone for joining us.
Yeah, thank you. Robert and Duani, I don't know.
Sure. So I think just kind of distilling it down to a couple of key bullets. I think one thing that really emerged is when we think about resilience and sustainability as an issue of quality, it's impossible to disentangle that from issues of equity, from empowerment, from quality services and supply chain. How these are all just inherently intertwined. Who's losing services around kind of these disasters, and how do we ensure that that we've got the resilient systems there? I think a couple of key points is making sure that we're building this into the planning, building this being kind of ideas and preparedness plans for future disasters, and making sure that this is all kind of integrated across the entire system, and really not kind of putting the entire burden of resilient systems just on the households, because they're facing kind of repeated needs to reinvest, to rebuild. And how can we make sure that this is something that's part of the entire system, and this foresight and knowledge and preparedness kind of across all of the levels. So I'll stop there, but thank you for participating. We've got a few pages on the whiteboard covered, so.
Nice. Thanks, Robert. Do you want me to go or do you want to? Yeah. Okay, I'll just go quick. So we touched on a number of items were around safety, reliability, quality assurance, quality control. The first group, we talked a lot about procurement, but not just procurement of materials at the beginning of a project, but also what happens after construction of those water systems. Does the local market have the capacity to provide quality materials when we're looking at repairs and rehabilitations to those systems? Then we talked about, well, if they don't, what can we do about that? And so a little bit about capacity building, World Vision's experience working with local suppliers to train them on new standards, and then also government figuring out how do we reinforce or enforce a regulatory framework around standards. In the second group, we talked about a lot of different things. We talked about externalization of costs. Actually, that was the first group, sorry. But then we started to talk a little bit more about this idea of quality versus quantity in a sense. So as we scale and try to provide greater impact, how do we also do that in a way that provides quality services? And are those two kind of battling with each other, or can we figure out a way to do them both at the same time? I'm sure there's more there, but those kind of the key highlights. But thank you all so much. I think that's all we have. We'll end a little bit early so you can get coffee, but we really appreciate you coming out and discussing. If you want to discuss more, please come up to me or anyone here, and we'd be happy to discuss with you. So thanks so much.
So yeah, it was years ago, but it was in Ghana with
2014.
yeah. Patrick Mamankwa and then Pastor Vincent.
Yes,
It's in yet, which I don't know. I mean, now you're in Mali, so you probably don't ever see him, but
I go very often to Ghana.
do you? Yeah, good. I haven't been.
In December, I will be there.
No kidding.
Yeah.
Oh wow. If you see.
Are you still in Ghana?
No, well, we still have the drill team.
Okay.
It's still there. I'm no longer involved with it, but I am in touch with Pastor Vincent
Okay.
fairly
He's a
regularly.
good guy.
He's a good man.
Send your regards to him.
Yeah, dude, will you? It's so good to see you.
Yeah, me too.
Yeah, very good. Take care.
Nice to meet you.
I was gonna ask how it finds
Like that. You guys.